We are starting to see a few more patients over the past few weeks.
Nobody wants to lock back down. Nobody wants to be Michigan, Chicago, Vermont right now.
With COVID cases surging in other parts of the country, local health officials are warning that the virus is climbing again in the New Orleans area. So New Orleans just raised its coronavirus threat level to the highest point. That would be called code red.
Paul Murphy is reporting that city leaders are saying now is the time to double down on your efforts to slow the spread of the virus.
Coronavirus code red in New Orleans means there's an active outbreak in the city.
As you've seen locally over the last week or so, our cases have been up significantly, and our positivity rate, although it's still very good, has doubled in the last week, causing us some concern.
According to the city's COVID-19 dashboard, New Orleans has averaged about 81 new cases a day for the past week, and the test positive rate has climbed to more than 2%. City Health Director Dr. Jennifer Avegno says while the upward trajectory is troubling, it's not too late to head off another surge.
And you can read every day, it seems like there's a new state or a new city that is going far back to lockdown, and we do not want to do that.
Dr. Jeffrey Elder at University Medical Center says his hospital is already seeing an uptick in coronavirus patients.
We're nowhere near where we were in March and April and July. But you know, this could be an early indicator that we have more of the virus circulating in the community.
Right now, there are about a dozen coronavirus patients being treated here at UMC. Dr. Elder says that number could increase rapidly if we're not careful.
Now's the time that we take those public health measures like social distancing, like wearing masks, just being careful in public.
Louisiana Fire Marshal Butch Browning says statewide the numbers are also heading in the wrong direction. The state reported more than 1,300 new COVID cases on Wednesday.
Bottom line is people are getting sick, and we know when people get sick and we know when hospitalizations occur, the end result is we see some people who die.
With the Thanksgiving holiday approaching, public health officials are asking people to keep family gatherings small, distant, and outside as much as possible. Paul Murphy, Eyewitness News.
Dr. Avegno tells us they're now seeing community spread of the coronavirus from parties, large and small. She said people are just getting too close, taking off their masks, and they're infecting 1, 2, or even more people.